With the patient in case B, the first technique that I would do to help him is if he is lacking joint play or joint range of motion, and when you go to that end range you feel a bony block, I would do some joint mobilizations at the wrist because he's been in that unoptimal, just immobilized state for so long that he might have less range of motion than he did previously. And so one way to the way I would do it, and I would stay away from that if I thought it was a muscular contracture, then I would go more towards stretching. But initially, what I would do is if my patient was lacking flexion, I could distract to about a grade 1, and then I could go with a dorsal glide because it's convex concave for movement, and then opposite for flexion, and then you can do the same with radial and ulnar deviation if you feel those are needed. And the next thing I would do is I would do a cross friction massage. And so with this patient, he's going to have surgery, so he's going to have an incision. And if the incision does not heal properly, one way to help break up that scar tissue and just decrease the adhesiveness of the scar and make it more mobile is more like regular skin would be to do a cross friction massage, which is just simply say the scar tissue is right here in this area. You just cross over it back and forth until you can feel some of that adhesiveness and stickiness just kind of splitting up. And I would do this daily at the end of our session just to try to get more play if that is lacking range of motion in that area because of that. But if there's some inflammation going on there, I might want to stay away from it a little bit because you don't want to spread those inflammatory compounds anywhere where they're not needed at that time.